Welcome to NCPDP, Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators, discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Well, Jeff, welcome to the NCPDP Unscripted podcast. So excited for you to join me today.
Thank you for the invitation. Excited to be here.
Yeah, so we just got out of a great session, a healthcare executive roundtable. So I'm going to chat with you a little bit about that. But
Yeah.
first, want to hear about the Pharmacy HIT Collaborative. So I'm sure some of our members know you, but for our listeners, can you tell us who you are and what you're doing these days?
Certainly. Well, I'm excited to be a part of the collaborative now. I've spent most of my career in the state exec mode in Washington State with the Washington State Pharmacy Association, and in the midst of that, it became apparent that there was this chasm of health IT connectivity to pharmacy after we were able to get recognized by payers for the services we provide. It was this now what moment. I don't know if you've seen I'm trying to remember the movie. Anyway, we had this. Yes, we opened the door. Great.
Right.
Now what?
Yeah,
We're there.
exactly, yeah.
Finding Nemo. Or no.
Yeah.
I think it was Finding Nemo.
Yep.
They get out into the bay.
Right, and
They're
then-
out in the bay, and they're like, now what?
Right.
So we had to actually learn a lot about
Yeah.
how to bill medical claims, and then there was really a disconnect with the IT. And so, of course, over the last 9-10 years, that's reared its head again and again.
Yeah.
Washington, we've navigated it a bit, but there's still some issues with connectivity, and it became really evident to me that the focus was always from a provider side on getting paid.
Yeah.
And really, the powers and the data that we would be sharing, and that was not the focal point. And without MIPS or meaningful use, the ability to actually implement an EHR or some capacity to collect that data and to be able to share it was still missing. So with the opportunity to be a part of the collaborative, it's like now this is a major barrier that we still need to tackle. And the work that the collaborative has done over the past 15 years under Shelley Spiro and the amount of amazing volunteers that have contributed to the effort has put a lot of tools in place. Of course, working with NCPDP and SureScripts and PQA as members to help with the strategic members, which are all the national associations, or the vast majority of them, that we are able to really put together the pieces. But there's still some missing parts. And so with that, the focal point now is what can we do moving forward to really tackle the clinical workflow aspect within the pharmacy with AI and the moving parts, as well as the interoperability, which is in many ways, maybe as I'm getting into it, maybe more advanced than most people know. So we need to communicate that and really see what we can do to help vendors and other stakeholders that are around the table help us to achieve this interoperability that's necessary for value-based models, as well as the future of our profession and patient care.
Yeah, absolutely. So you've been executive director for how long now? 9 months? 10
Almost,
months?
yeah,
Okay.
yeah. I
That's
guess.
some big shoes to fill with Shelley retiring.
Yeah, surprisingly very big shoes for small feet.
Yeah.
Right. But she has so much knowledge in her head, and she's been in all these different circles. And so I've spent the first 7-8 months really trying to understand all the players, the stakeholders, all the moving parts, whether it's the Passio Project, HL7, you've got Sequoia Project that's instrumental in this, and a bunch of efforts that I think in talking with most folks, they might not be overly aware of. So I'm going to do my best to help shout that from the rooftops, and really, but I want to make sure that we've got, all the kind of directives clear, and some of that is really agreeing on what kind of standardization we can all agree on as a profession that matches what the other providers are doing,
Yeah.
so that we are in alignment with what the plans are dealing with, what the other that stakeholders are able to collect and utilize.
Yeah, I think you and I have been in a lot of the same rooms recently, and I just feel like there's a movement right now, right? And there's so many things coming together around this. Would love for you to talk a little bit about the work you guys are doing around kind of the pharmacy EHR.
Yeah.
I think we heard in one meeting, I can't even remember what meeting we were in, like pharmacists can't be on their own island, right? Like we
Right.
need to play in the same space as the providers, even if it's, even if we don't have the same, parity in terms
Yeah.
of payment and all that. So really curious what you guys are doing at Pharmacy HIT Collaborative
Right.
around that.
Yeah, no, so looking back at my foray into the collaborative, our work group for our interoperability work group had published a paper early last year on interoperability, and they alluded to the ONC or ASTP ONC. And I don't want to use acronyms, but there's a lot of them.
There
I
is.
thought pharmacy had a lot of acronyms. Tech,
Yeah, the
health
clinical
tech
side
for
has,
sure.
yep.
But that entity has put together a base EHR certification and the criteria. So it was alluded to in that paper. Well, we're about to publish the follow-up to that paper, which really goes into the demystifying those criteria, so that pharmacists and pharmacies and those making the decisions for pharmacies, independent of setting, understand what is necessary for a functional EHR to make better decisions, and then the vendors that are working with us to understand what we will need to be able to, one, store that data and translate it. So from that certification, and it's with a pharmacy focus is how we looked at it.
Yeah.
And then tying in the rules that have come from the 21st Century Cures Act, the HTI 1, 2, 3, and now 4, which was just
Right.
recently
Yeah.
released,
Right.
and how those have expanded and clarified a little bit of what that looks like for us. And so
Yeah.
that, really excited that that's coming out, because what I've noticed, at least in the conversations with amongst the groups, is we really don't have a clear picture of what the data output capacity of pharmacies is without some sort of a EHR or an EHR Lite that can then utilize the SNOMED codes and the FHIR interfaces, or whatever the CCDAs, whatever the format is,
Right.
to translate the data to all the folks that need it.
Yeah.
Then they can receive it. It's jumbled. It's not in a format that they have to manually put and dig into, because I think that, from what the payers have said, is a real big barrier to them seeing the value of what we're doing.
Yeah, absolutely. And just, as we start to talk more and more about pharmacists providing these clinical services, I mean, we just heard in this roundtable, there's so much that they can be doing, right? But
Right.
then it's like, how do they make sure that the data's available? And I think the other way too, right, of the pharmacist being able to access a patient record to provide clinical services. So I know you guys are gotten involved with the Sequoia project,
Yes,
the
very
Pharmacy
exciting.
Interoperability Work Group. Curious your thoughts on that, and how things are going there for you. And
I think the recognition of pharmacists and having this pharmacy work group within the Sequoia project is crucial for our profession. We often talk to ourselves.
Yeah.
As a profession, and I think we can all agree to that.
Yeah.
Whereas this is already the recognized entity for the quality health information networks, and so there are players there that might not even be thinking pharmacy, and for us to be able to be very visible and work within that group and demonstrate that to many who may not perceive the role or perception of what pharmacists do in the services, in the care side of the equation, and as use cases to demonstrate how that works, translates with some of the work that we've been working on in the post-acute care setting and transitions of care, that has already gone through a few connect-a-thons and been tested. It's an easy it's an easy connector when we were able to demonstrate that. And without us creating something that's uniquely pharmacy,
Yep.
we just are demonstrating how that works alongside what other providers are using as a format.
Yeah, that's great. So you guys also put out some white paper on AI in pharmacy. I'd love
did.
for you to share a little bit with our audience about that.
Yes, the dynamic and ever-changing world of AI.
Yes.
It's a wild, wild west.
Yeah.
So we did publish one last year. In reviewing it, largely, it's your common sense sort of stuff, right? AI, be cautious, don't be afraid of it.
Yeah.
It can be useful in the different ways it can be useful,
Yeah.
whether it's clinical decision support or if it's dictation efficiencies. There's a number of different ways. It could be even managing inventory. So AI can be beneficial, but there should be caution. There's definitely a need to be judicious and have a human component within its review. And so I feel like that work is going to be ever evolving,
Yeah.
and that almost by the time something's published, we
Yeah.
need to start again.
That's true, yeah.
But it is crucial that we are aware of it and we know how to utilize it. The efficiencies within healthcare that have been achieved by a lot of other providers in this space have been, well, one, they've kept people in the profession.
Yeah.
With all the stress that providers, pharmacists included, have on a day-to-day basis, their quality of life, this has allowed them to get back to looking a patient in the eye
Yeah.
and caring for them,
Yep.
and not spending 3 or 4 or 5 hours after work or before work looking up everything you need to know to make this care the most informed.
Right.
And so there are some really key components to that,
Yeah.
and you're already seeing it being tested with CDS hooks and
Yeah.
and just these, the pop-ups, the triggers at, hey,
Yeah.
we're about to start an encounter. Here are some things you consider. And
Right.
so understanding how we can appropriately either shop for that or
Yeah.
find the right vendor for it, and then if we need to advocate in the appropriate areas to make sure there's no information blocking and that there's the appropriate viewpoints to make sure there's no biases
Yeah.
embedded and all of those components.
Yeah, makes sense. Well, I know we're getting to the end of our conversation. Would love to have you share how do folks get involved at the Pharmacy HIT Collaborative? Is it the organization, or
Yeah.
can they look for your resources?
Yeah.
Share a little bit with
Absolutely. The resources are all available without any logins or anything
Yeah.
on the pharmacyhit.org website.
Great.
But if you are interested in being a part of the conversation, we need more viewpoints at the table. The different perspectives are necessary for a better finished product, and so if you are a member of any of the national associations and are interested, they can appoint you to be a part of our work groups.
Great.
Or our associated members, our affiliated memberships, which we have a broad variety, and NCPDP is one of our first, I think.
Yeah.
Right. And so, from that perspective, we really we encourage it. We would love to.
Perfect.
So if you are interested, and look onto the website where you can look at the work groups, you can see who has been assigned to the group already, as well as the leadership. And there's ways to contact me if you're interested in being part of it, or if and I can help to figure out a way to be involved. We'd love to have more people at the table.
Great, fantastic. Well, thank you so much for joining me.
Thank
and
you.
I know it's been great to kind of get to know you over these past few months, and
Yes.
my new role and your new role. And I feel like there's just such great collaboration and moving all this forward.
Future's
and,
bright.
And the
I'm
time's
excited.
right. I am
Yes,
too. So
yes.
fantastic.
Well,
Thanks for joining me
Thank you.
today.
Appreciate it.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.